Newly diagnosed myeloma patients have traditionally been treated with induction therapy followed by autologous stem cell transplant and then some type of maintenance therapy until disease progression in the US. The GRIFFIN trial was looking at the addition of daratumumab to Revlimid, Velcade, dexamethasone induction therapy prior to transplant, and then giving cycles of consolidation therapy post transplant, followed by maintenance therapy with either Revlimid or Revlimid with daratumumab. The goal was to see whether we could induce deeper responses that could be sustained over longer periods of time with the addition of daratumumab to the regimen.
Okay.
So the current abstract looked at the patient reported outcomes that were surveys completed by patients at set time points in the study. So the patients were assessed at baseline at the beginning of each cycle of therapy, just before they went to transplant, when they were in the post transplant consolidation phase of treatment, and then at set time points through the maintenance portion of the studies. And the data that we reported included at least 12 months of follow-up for all of the patients who had remained on the trial. So the results were that we saw a improvement in patient overall perceptions of pain and fatigue and ability to function for both arms of the study. So patients felt better as they were being treated with both combinations that were tested. We had more improvement in pain symptoms for the patients who were receiving daratumumab in combination with the RVd background. And I think it's interesting that we saw improvement that continued to improve further following transplant, following consolidation, and throughout the maintenance phase of treatment. It's something that I personally wondered about. Would patients who were continuing on a more intensive maintenance regimen have a less good quality of life than the patients on the lighter maintenance regimen? And that was not the case. The data are all changed compared to baseline, and the way that the scores are calibrated are based on how the patients answered the questions. So we were seeing at least what they called moderate improvements in pain. And so of course we're hoping that the patients are being consistent as they're assessing the pain. But it does correlate with improvement in their overall functional status and their overall outlook on life as a more positive statement at the end of the treatment. I don't think that there is going to be a phase 3 trial. We've learned that daratumumab is increasingly used in the induction therapy for newly diagnosed patients who are considered to be transplant eligible. We are continuing to look at patient outcomes in many different trials to see how the toxicities of therapy are managed and how those change over time.